My name is Dr. Sonal Varma. I am a pathologist in the Department of Pathology and Molecular Medicine here at KGH and Queens. My specialty is breast and GI pathology. My project is about a special group of lesions in the breast that's called fibroepithelial lesions. They occur predominantly in young women, and there are two main subtypes within this category: a fibroadenoma and a benign phyllodes tumor. The problem with these two is they look very similar on radiology, so there's no way for a breast imager to differentiate between fibroadenoma and benign phyllodes tumor confidently on imaging. When we get the needle core biopsy from these lesions in very young women, sometimes 13, 14, 18 years old, um, there is a lot of morphologic overlap between fibroadenoma and benign phyllodes tumor. So it can be really hard for us to differentiate between them on small needle core biopsy specimens. So now, why is it important to differentiate between these two? The reason is fibroadenoma can be just managed clinically. You don't need to excise it. You do not need to take it out of the breast. Whereas phyllodes tumor, you need to excise. The margins are important in some cases. If left unchecked, it will grow and cause more problems later on. So a lot of young women, because we cannot differentiate them completely on needle core biopsies, we may err on the side of caution and say benign fibroepithelial lesion cannot exclude phyllodes or favor fibroadenoma or something like that. And then these women end up getting excisions. In our hands, about 50% of excisions have turned out to be fibroadenoma, which is a number comparable and even better than some of the biggest academic centers. So with this huge burden on healthcare for young women getting surgeries, and also with surgical wait times in our publicly funded healthcare system, me and my team, we started wondering if there's anything we can do to more reliably distinguish between these two on needle core biopsy. And the answer comes from AI. There's only one or two studies out in the literature trying to differentiate between fibroadenoma and phyllodes using artificial intelligence and convolutional neural network type of methodology. Those were smaller studies. We have collected a large number of cases, about 1,000 fibroepithelial lesions with follow-ups on them, more than 5-year follow-up in some cases. So we can have a very robust data set here locally at KGH. And SEAMO has provided this innovation funding to us for this project. I'm collaborating with the AI chair from Vector Institute, Dr. Parveen Musavi, for this. So she will be helping with the computer-aided diagnosis part. Her postdocs, we are also going to have a student working on it. So it's a very collaborative project between engineering, computing, and us in medicine and pathology. In many ways, this will impact the healthcare delivery in Ontario and hopefully outside of Ontario. Firstly, young women, so it's patient care. Young women who do not need surgery should not have to go through surgery. So that's the biggest impact. The second is when these women who we can avoid surgery on are going through surgery, we are using up OR times. And we already have a lot of backlog in OR times. There's very limited availability of ORs physically and the OR staff. So we should be able to manage better with this healthcare delivery system in Ontario. Thirdly, we can also expand this as a regional tool or as a broad tool, and this equalizes care. So not all centers will have a breast pathologist. So if we can add this module to their microscope or their digital microscopy techniques, then people get equal care no matter where they are, so that they have a better chance of getting a more accurate diagnosis from their needle core biopsies from very small specimens, but it equalizes care for everybody. So SEAMO has been instrumental in getting seed money for many of these innovation projects that are ideas that may become fruitful, but they may not go as we planned. But having that innovative curiosity being helped by SEAMO is what a lot of us researchers like me, who who really value a lot, and we cannot do our work without this kind of support and funding.